Welcome, ladies and gentlemen, to sqadia.com. My name is Mohammad Usama, and today we are talking about the nervous system pathologies. And this specific lecture, we are going to talk about the demyelinating conditions or demyelinating disease of the nervous system, as well as the ocular diseases. And in this, we're going to talk about different conditions, including but not limited to multiple sclerosis, Guillain-Barré syndrome, and different type of ocular diseases. So let's start off with the demyelinating diseases. So in demyelinating diseases, there is one common thing, which is the destruction of the myelin sheath, resulting in different type of neurological symptoms. So this myelin is actually covering the axons of the different type of neurons, and it helps in the impulse transmission, and due to the loss of which there is actually the disruption in the nervous system function. And there's also different type of conditions which result in the deterioration of the axon, but in this there is commonly destruction of the myelin, but the axons are usually preserved. So the conditions are the multiple sclerosis, the acute disseminated encephalomyelitis, and Guillain-Barré syndrome. So let's start off the multiple sclerosis. So multiple sclerosis is a demyelinating disease of the nervous system in which the insulating covers of the nerve cells in the brain and spinal cord are damaged. So it is actually a condition targeting majorly the central nervous system instead of the peripheral nervous system. The incidence, talking about the incidence of the multiple sclerosis, it is the most common demyelinating condition or disease, and the most common age for its incidence is around 20 to 30 years and is more commonly found in women as compared to men. The highest incidence is found with Northern European ancestry, and one important thing is that there is an environmental influence when we talk about the epidemiology of the multiple sclerosis, because the incidence is directly proportional to the distance from the equator. So the people who are living away from the equator, so the incidence is greater in those individuals. But one important thing is that if the individuals or people move towards the equator, so that can result in a change in the environment. But after 15 years of age, if someone moves closer to the equator, then that would not actually result in a difference in the multiple sclerosis or the incidence of multiple sclerosis. The etiology of multiple sclerosis is unknown, but it is thought to be of multifactorial in origin, with both genetic and environmental factors playing a role, and as we already discussed, that it has an environmental influence as well. So what are the common things associated with this? One of them is the increased cerebrospinal fluid immunoglobulins in cases of multiple sclerosis, which suggests that there is either a viral or immune factor association that results in a major role in the development of the multiple sclerosis. Other things include that there's an increased incidence with certain HLA haplotypes, which are actually a set of genetic determinants located on a single chromosome, which suggests that immune and genetic factors may also play a role in the development of multiple sclerosis. What are the morphological changes which occur in the central nervous in the multiple sclerosis? One important thing is that the morphological changes in the multiple sclerosis are confined to the central nervous system, which is the brain and the spinal cord. And these morphological changes include the depletion of myelin, as well as the depletion of myelin producing cells, which are actually the oligodendrocytes or the supporting cells of the neurons, with multiple focal areas of demyelination, which are also known as plaques, and they are actually irregularly arranged in the entire central nervous system, and there is no specific arrangement. The most common sites involved in the multiple sclerosis are the optic nerve, the brainstem, and the paraventricular areas in the brain. There's also observed that there's also T lymphocyte and macrophage infiltration into those areas, resulting in infiltrate plaques followed by reactive gliosis. So here you can see in this picture, this is the normal axon of the neuron surrounded by a myelin sheath, but in multiple sclerosis there's actually scarring and degeneration and depletion of this myelin sheath, resulting in different type of neurological signs and symptoms. So what are the signs and symptoms, and what is the clinical course? So there's a variable clinical course depending upon the site of the involvement and this, obviously the symptoms. So the symptoms include numbness or weakness in one or more limbs that typically occurs on one side of the body at a time instead of both sides being involved simultaneously. And there is a partial or complete loss of vision of an individual suffering from multiple sclerosis, and but this once again usually occurs in one eye, as we talked about the numbness or weakness, which was also occurring on the one side. And it also is associated with pain during eye movement. There is also a prevalence of prolonged double vision, which a person sees two things at once. And there's also tingling or pain in parts of the body, which is also known as paresthesia. There's also electric shock-like sensations that occur with certain neck movement, especially with forward bending of the neck, which is also known as neck flexion, which is also known as Lhermitte's sign. There are also tremors, and there's lack of coordination and unsteady gait, which means there are also gait problems as well. There is slurred speech and aphasia, and there is fatigue, dizziness, and there can also be bowel and bladder symptoms, or bowel and bladder function problems as well. So you can see in this picture there is the lesion, for example, in the multiple sclerosis. So there is numbness, tingling, and pain below the lesion, and you can see that there is actually demyelination, and the nerve fiber or the axon is actually exposed because of this disruption of this myelin sheath. Another condition, which is the acute disseminated encephalomyelitis, it is somewhat similar to multiple sclerosis as well, but it is also different. So acute disseminated encephalomyelitis is actually a rare autoimmune disease marked by sudden widespread attack of inflammation in the brain and spinal cord. So that is one common thing between the two, is that both of them are involving the central nervous system. So as well as the inflammation of the brain and spinal cord, it also attacks the nerves of the central nervous system and damages their myelin insulation or the myelin sheath, just like the multiple sclerosis, resulting in destruction of the white matter. It is often triggered after the patient has received a viral infection, or if the patient has received any kind of routine or specific or non-routine vaccinations, because those vaccinations can also result in autoimmune response. And the symptoms resemble multiple sclerosis, but they're also different from them. Like, for example, unlike multiple sclerosis, in children, there is usually it is marked with rapid fever, and although adolescents and adults can get the disease too, but it is very common in children and associated with fever, even though it is a rare disease, but fever in children is common. So it also consists of a single episode or a single flare-up, whereas in multiple sclerosis there are multiple flare-ups. Even if there is a remission of the condition, then there can be a flare-up once again, and the condition can relapse again and again over a long period of time, but that does not occur in acute disseminated encephalomyelitis. But if there are actually relapses occurring again and again, which can occur in a quarter of a patients with ADEM, but in those patients, those multiphasic presentations can be likely because of the multiple sclerosis instead of acute disseminated encephalomyelitis. It can also be distinguished by multiple sclerosis because of a loss of consciousness, coma, and death, which is not so common in multiple sclerosis, except for the very severe cases. So what are the most common causes of acute disseminated encephalomyelitis? It can either be because of infections or vaccination, as we already discussed. So the viral infections that can result in acute disseminated encephalomyelitis include measles, mumps, cytomegalovirus, rubella, hepatitis A, and chickenpox. On the other hand, pyogenic infections or bacterial infections can also result in ADEM, which include myoplasma and Salmonella typhi. Post-vaccination acute disseminated encephalomyelitis can be secondary to influenza vaccine or smallpox vaccine, for example. Now we have another condition or another demyelinating condition which is known as Guillain-Barré syndrome. It is an acute inflammatory demyelinating disease primarily involving peripheral nerves. So that is one difference between Guillain-Barré syndrome and multiple sclerosis, that it involves the peripheral nerves instead of the central nervous system. It has the highest incidence in young adults, and it is usually preceded by viral infection or a routine or non-routine immunization or an allergic reaction. So it has an autoimmune etiology similar to multiple sclerosis, and as we already discussed, the acute disseminated encephalomyelitis. There is also an ascending muscle weakness and paralysis starting from the distal part of the lower extremities and then moving upwards. So that is one of the characteristic features of the Guillain-Barré syndrome. It can also result in respiratory failure and death can also occur, but most patients usually recover from these symptoms. And there is a greatly increased protein concentration in the cerebrospinal fluid in these patients, but only a modest or a slight increase in the cell count. So let's look at the risk factors. So risk factors include one is the autoimmune, such as an viral infection or an immunization or allergic reaction, and it is frequently preceded by a mild respiratory or intestinal infection. It progresses over hours to days, and there is actually a minimal muscle atrophy progressing from distal to proximal, and you can say that there is an ascending muscle weakness or paralysis. It begins in lower extremities and ascends bilaterally, and it can be with weakness, ataxia, which is a problem in the gait and coordination, and bilateral paresthesia, which is the abnormal sensations perceived like numbness and tingling sensations, which can result to paralysis as well. And the paralysis is actually symmetrical and causes problems with respiration, talking, swallowing, and even bowel and bladder function. Now, talking about the ocular disorders, there are different types of ocular disorders. One is the conjunctivitis, which is actually the inflammation or the swelling of the conjunctiva. So you can see here, you can see there is the normal conjunctiva and there's an inflammation and redness of the conjunctiva, which is known as conjunctivitis. There's also an condition which is known as retinopathy of prematurity retinopathy, which means that the retina is actually being involved, and it is also called as retrolental fibroplasia or Terry syndrome, in which there is a condition which affects the eye of the prematurely born babies, which are originally having received intensive neonatal care and also receiving oxygen therapy, and because of the irritation from the oxygen, they can result in the development of retinopathy of prematurity or retrolental fibroplasia, and this is usually given to those children which are having premature development of their lungs. So in those children it can actually appear. Then there is diabetic neuropathy, which is comparatively common, and especially in the feet of the individuals who are having diabetes. They can develop diabetic neuropathy in the foot, which is also known as diabetes foot, but it can also, this diabetic neuropathy can also occur in the eyes, or you can also say that it can also result in ocular disorders, and it can be of two types: non-proliferative diabetic neuropathy, which is also known as non-proliferative diabetic retinopathy, or the proliferative diabetic retinopathy. So non-proliferative, as the name suggests, it is less severe form, and it is the early stage of diabetic retinopathy, and in this stage there are actually tiny blood vessels within the retina where the image is formed in the eye, and they start to leak blood or fluid, which causes the retina to swell up or to form deposits. And the proliferative diabetic retinopathy, on the other hand, is a more severe or advanced form in which there is lack of oxygen in the retina, resulting in angiogenesis, which results in the formation of fragile new blood vessels, to grow along the retina and in the clear gel-like vitreous humor that fills inside of the eye as well. So without timely treatment, these new blood vessels can bleed and cloud the vision and destroy the retina. So this is the normal retina, and here you can see that there are different hemorrhages are occurring in different areas, and there are also aneurysm occurring in different areas of the blood vessels, and these are also observed as the cotton wool spots when you're inspecting the eye, and there's an abnormal growth of blood vessels and angiogenesis which are prone to get ruptured and resulting in bleeding in the vitreous humor as well as the retina. Other ocular disorders include retinitis pigmentosa, in which there is actually a rare genetic disorder involving breakdown and loss of cells in the retina, once again, which is the light sensitive tissue on which the image is formed that lines the back of the eye, and the image is formed there. The common symptoms include difficulty seeing at night and loss of peripheral vision as well, which is on the side. This is the medial vision, and this is the peripheral vision for one eye. So there is another, which is the senile macular degeneration. This is age-related, and with advancing age it occurs, and it results in blurred or no vision or complete blindness in the center of the visual field only. So not on the whole eye, there's only the blurring or blindness in the center of the eye. As you can see that this is the normal retina, this is the optic disc, this is the macula, and here you can see that in the center there can be a wet macular degeneration or dry macular degeneration, resulting in blurred or loss of vision in the center of the eye only. Another condition which is very commonly heard of is the glaucoma. So it is associated with elevated intraocular pressure, which is the increased pressure inside the eye, in which damage to the eye's nerve, which is also known as the optic nerve, which takes the message of the visual stimuli from the eye to the brain, can occur, leading to loss of vision and even blindness. So glaucoma is one of the leading cause of irreversible blindness in the world. And here you can see in this picture that there is actually increased pressure, which is putting pressure on the optic nerve, and the damage of that optic nerve can result in blindness. There's another condition known as retinoblastoma, which is a rare form of cancer that rapidly develops from the immature cells of the retina and the light detecting tissue of the eye, which is on which their image is formed. It is the most common primary malignant intraocular cancer in the children and is almost exclusively found in young children. So that was all about the demyelinating diseases or conditions of the nervous system as well as the ocular diseases. So stay tuned for other lectures in this series and keep on watching sqadia.com. Thank you very much.